Meeting to order. City Laredo Special Meeting. 2025, 4:40 p.m. All stand for the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Now we do the Texas pledge. Honor the Texas flag.
I pledge allegiance to thee, Texas, one state, under God,
One indivisible.
Cool. Yeah. Moment of silence, please. Thank you. You may be seated. Mr. Secretary, roll call, please.
Yes, Mayor. Honorable Mayor, Dr. Victor D. Trevino.
Present.
Honorable Council Member District 1, Gilbert Gonzalez. Honorable Council Member District 2, Ricardo Rangel Jr. Here. Honorable Council Member District 3, Melissa Cigarroa. Honorable Council Member District 4, Ricardo Rick Garza.
I'm here.
Honorable Council Member District 5, Ruben Gutierrez Jr.
Present.
Honorable Council Member District 6, Dr. Tyler King. Honorable Mayor Pro Tem and Council Member District 7, Vanessa Perez. Honorable Council Member District 8, Alisa Cigarroa. Mayor, you have a quorum.
Thank you. We'll start out with, do we have any citizens' comments?
No, Mayor.
No citizens' comments. All right, we'll proceed with communications. Presentation by Mayor providing general comments on city matters, upcoming initiatives, and other relevant updates for the City Council and the public. A reason I convened this special meeting of the City Council is that we can address some of the core functions of the city that have been impacted and will be facing with serious challenges for the city if the federal government were to stop, or the funding were to stop. There are several programs and employees that are impacted by the limitation or pausing of federal funding. And as we all know, public health is a core function of the local government. One of the programs that runs to the Laredo Health Department is the Women's, Infant, and Children Program, commonly known as WIC, which is fully funded by the USDA federal grant. The Health Department has around 70 employees that are associated with this program that benefits thousands of families in Laredo and Webb County. For the public to know, the WIC program provides free healthy foods, nutritional education, breastfeeding support, and referrals to other health and social services for pregnant, postpartum, and breastfeeding women, as well as infants and children up to the age of 5. Participants may also receive the Texas WIC card to purchase specific foods like milk, eggs, fruit, vegetables, infant formula, along with other benefits such as health screenings and to support new mothers. And a little background on the funding. Currently, the government is operating through a 15-day funding confirmation letters, which is clearly not enough time for the city our size to plan and make a large financial decision. And if the federal government decided to stop funding on programs, now I understand that there has been $300 million allocated, transferred over to keep the program temporarily funded. But from my estimation, that is only about 10 to 15 days, especially since the WIC budget for the entire country is $578 million. The WIC program locally receives 6.5 annually. So the real challenge will be if the shutdown continues this month, or at some point we do not receive the 15-day funding letter, I believe that this is a big policy decision on how we will be able to fund this program. And as mayor and someone that has worked at the health department, I believe that this program is vital. It's a vital service. So I'd like the council to provide direction to the city manager after we hear from Dr. Chamberlain on what their plans are and if the funding were to stop. So before we go to the city managers, I'd like, my initial motion would be to give the city manager instructions to continue funding the WIC program and providing services to these families through WIC program in the event that the city is informed by the federal government that there is no more funding. At which point, we can have another special meeting if needed to determine the long-term plan of this program.
Mayor, I'll second for discussion.
Second, thank you. Go ahead.
Good afternoon. Sorry.
Go ahead.
Good afternoon, Mayor and members of the council. Dr. Richard Chamberlain, your Laredo Public Health Director. I prepared a brief presentation about Laredo Public Health programs during the federal government shutdown. And so just to provide you some context, WIC is with the Texas Health and Human Services Commission. And of course, then we have a multitude of other federally funded programs that are through the Texas Department of State Health Services. We haven't received a direct communication from HHSC, but HHSC is the parent organization of Texas Department of State Health Services, and we have been getting communications from DSHS. One of them is on your screen, as you can see, which we received on the 9th, letting us know that the previous notification that was sent to us about funds expiring on October 15th was rescinded, and they issued an updated letter informing us that funds will be reevaluated on October 31st. So just to give some context about the programs that are facing funding uncertainty, it includes our preventative health and obesity prevention, our public health infrastructure grant, our immunization program, our HIV/STI prevention program, our TB federal and binational program, our public health emergency preparedness program, our WIC program, our Healthy Texas Babies program, our Children with Special Healthcare Needs program, our primary healthcare, other primary healthcare programs, and our family support services program. So these programs are operating under the constrained budgets of or facing partial suspension, putting services for vulnerable populations at risk. And so here's just a breakdown if the federal funding were to cease for all these different programs that are operated by Laredo Public Health. It's a total of 102 staff members that would be impacted, with a cost per pay period of $251,000, a total of 13 programs. Removing the WIC program, there are 30...
Mayor, if I may.
Yes, go ahead.
Mr. Richard, can you repeat the number amount?
Going back to the complete fiscal picture, we do have 102 FTEs. This includes the awards from DSHS, Texas Department of State Health Services, and the awards from Texas Health and Human and Service Commission, for a total of 102 staff members comprising of WIC, and as you can see, a couple of other programs that are here on this screen. The cost per pay period to finance the staff members for WIC and the rest of the public health programs that are at risk, 102 of them, is $251,000 on per pay period. Removing the WIC program, so these are all non-WIC, it would be 30 staff members that were at risk, and this is an $87,000 cost per pay period to finance the 30 staff members for the rest of the programs that would be impacted. I did want to emphasize, though, that the Texas Department of State Health Services reimbursement timeline has been extended and is currently secured through October 31st of 2025, a crucial extension from the October 15th deadline. However, continued funding relies heavily on several critical factors: sustained federal operations without interruption, DSHS ability to draw down federal funds as needed, which I attended our Texas Association of City and County Health Officials meeting on the 9th, and we were advised that DSHS is able to draw down. Regarding WIC, today I'm pleased to inform that funding for the WIC program is secured through the end of November 2025. This positive development was confirmed by Ms. Ariana Valdez, our WIC administrator, at today's 37th Annual Texas Association of Local WIC Directors meeting, providing stability for this vital service. I did want to make it known to the council, should we get to a budget shutdown now at the end of November, and there is no funds for WIC, we could support the WIC staff, but the benefits that are loaded to those cards for the people, that is something that City of Laredo does not have the ability to do, since that is a state and federally funded program where those benefits are automatically loaded into their cards. So what we could do is sustain the staff members to ensure that persons upon the return of funding could then just be reloaded by making sure all their prerequisites on a monthly basis are all checkboxed before that happens. But luckily for WIC, we are good to the end of November with this new development, and I'm forecasting, if that is what has been told to WIC by federal partners to HHSC, as was shared with me on the 9th with DSHS, that should be the same trend that we'll see for the DSHS programs as well. And hopefully, before the end of next month, we do see an end to the government shutdown.
All right. Thank you.
Thank you.
Can I just follow up with one question?
Yes, go ahead.
In light of everything that's going on across the country regarding to the shutdown, so you're saying that we're currently okay till the end of November
Correct.
across the board for employees and the program itself?
Employees and benefits for the clients, patients, customers.
But you had mentioned the words until it restarts again. So there's a light at the end of the tunnel that it's going to be refunded again.
For WIC, we know it's guaranteed to the end with HHSC, Texas Health and Human Services Commission. We know that it's guaranteed to the end of November as of the development from today. For DSHS, we haven't received the new award, but at our meeting with the leadership with the Commissioner of the State Health Services on the 9th, we were advised that they are able to draw down. So they are forecasting that when they hit the drawdown button on the 1st of November, they'll be able to refill and back and ensure not refill, but just make sure that we're still getting paid out. As you may see on this slide for programs facing funding uncertainty, which includes the obesity, FIG, immunizations, HIV, STI, TB, PHEP, Healthy Texas Babies, all those programs will continue to roll out. And should there be an interruption, we also have a mechanism to sustain these individuals for another 4 pay periods.
Can you just mention briefly, and I'm not sure that I heard you say it, but if you could repeat it, if you did say it, how catastrophic it would be and to how many people it services here locally?
So just for WIC, we service more than 21,000 participants. So it would be very, very destructive in nature if they were unable to fill their benefits after November. But we know right now that their benefits will continue to be filled, and we're very hopeful that the government shutdown does end before the end of November. For our public health programs, as mentioned, PHEP, which is Public Health Emergency Preparedness, immunizations, those also service tens of thousands of persons as well. So these programs being paused for non-funding would have significant implications for the city.
Thank you.
Mayor, if I may.
Yes, go ahead.
Mr. Chamberlain, you said about benefits, how many, what do you mean by benefits? You said benefits, the employees and benefits for our,
That is, if I may, council member,
Just- yes.
benefits is the terminology that the WIC program uses for its participants to be able to reload the cards that they're able to utilize to purchase their food items
so we got from here to November
from here to November.
for them to reload.
Correct, which we were first under the impression that it would have been October 15th, then October 30th. Now we're being told it is
So
November 30th.
the amount of the 251K is for the
Strictly-
benefits or strictly for the
Strictly to
employees?
fund staff.
Staff, okay.
Mayor, man,
Yes, go ahead.
this question is for Mr. Neff. In case we do go into November, December, do you have a plan for us to move forward, not just the staffing, but the benefit part, for for the citizens of Laredo.
Mayor and council member, thank you for that question as well too. Back in June, when we lost the first grant within our system for the COVID testing and everything, we started an operational policy at that point in time, and we said that the city will continue providing a 90-day transition period of service continuity following the loss or interruption of any public health grant. Based upon that grant disruption timeline, the transition window becomes effective as soon as we're aware of it and we start walking through how are we going to sustain this after the 90-day window. Consider it a rainy day process. And so we will take our reserves, we'll take our funding in order to protect the program long enough to determine, is there another way we can do it? Is there another way that we can kind of provide that? So we are set, and we've used it effectively, I think, on at least 3 to 4 programs right now. And so the WIC being one of the biggest ones that I think that, which is what our concern is. But we will utilize our internal funding to keep everything operating for at least that 90-day window to determine, is there another way we can get this done? Can we notify everybody as well too? And this worked very well for us. This was done operationally. I would recommend that if the council appreciates how this is actually operating through that, if you could give me that formal blessing, I really appreciate that. Because what we'll do is we'll tap into our other funds in order to keep the program going until we can figure out what's going to happen with that program.
Okay.
And most of these programs have had a lot smaller group of citizens that were impacted. The WIC is just such a significant one with 21,000 affected families for that. So, but now feeding in for the benefits that we're receiving in the grants and everything, you know, the money from the feds in order to help cover those costs for those items, that's going to be a more challenging area.
Right.
But we did not want the service disrupted prematurely until we could find out exactly how we can actually fit it within our budget, because we may have to change our service structure over the next budget cycle. There's a lot of different things that'll have to go into it. We're just asking that this 90-day transition period provides us the opportunity to really evaluate what that impact is on us.
A news outlet earlier today was mentioning that hopefully by the end of the week, they'd have something worked out, or not the beginning of next week, which we're all praying it does. But I just want to make sure that we're prepared financially should this happen, because the people out there obviously are dependent on WIC and the other programs that are along.
Yeah, and that's been our goal since the early part of this summer as well too, was to make sure that none of our programs, we evaluate them completely through. Dr. Chamberlain's done a great job of moving individuals from one closed grant over to another grant and able to keep the service going. So we'll keep an eye on that, and we'll make sure that the council's aware of that. But as you consider this item, if you could at least bless the 90-day transition window, and then we'll keep you up to date as we move through that as well.
Do you need a motion to come along with it? Or?
I would appreciate that. That way, right now, what we're talking about here, 3 months worth for WIC for covering the staff is $565,000. So I would like that permission earlier than later, rather than a ratification.
Absolutely.
Go ahead, Councilman. All right, we have a motion and a second.
Oh, Mayor, if you'd like to modify your motion just to include the request by Mr. Neff for that.
Yes.
Then I'll
Yeah,
second
we'll
that.
put that 90-day window.
Is that sufficient, Mr. Neff?
Yes, that would work for me.
All right,
Thank you.
Okay. That motion as amended,
And a second.
and the second, all in favor?
Aye.
Opposed? Motion passes.
Thank you, Mayor and members of the council. We truly appreciate the support for public health. Thank you.
Thank you.
Thank you. Is that all for the special meeting? I think that's it. Motion to adjourn, and we
Second.
return back at 5:30 for regular council.
Motion second, all in favor?
Aye.
Opposed? Motion passes, meeting adjourned.